So we are going to cover the osteology. We call this topic as ribs, which is familiar with us as far as classification is concerned. We just make short about the classification, which is very primitive about talking about the classification of rib. Two way we can classify the ribs which is present in our body. So one way of classifying is that how these particular ribs are attached to our body. Some of the ribs are attached directly with the sternum, some of them are joined together then attached, and some of them are not attached at all. So we call these are ribs over there as true ribs which is directly attached to these particular facets in this particular sternum. Some of them are joining with the cartilage and then they are joining to this particular sternum or the sides of the sternum. We call them as false one. And the one which is not uniting or coming to formations to the sternum at all, we call them as floating one. The last two pair, which is hardly participate in formations, especially the 12th one, which is like a falling short, which is small ribs actually, and which is actually trouble for us if it is broken. they will they are called as floating ribs. Other than this, some of the ribs look alike. We call them as typical, which we are going to talk about today, and some of them are not similar looking. We call them as atypical. So this is the way we classify these classifications of the rib. So we take this typical one, and atypical is covered or not, I don't know, but atypical one, rib one, is kind of like a important for us. 2 and 3 and 11, 12, they are kind of atypical things. We are not going to talk about that things right now, but the atypical one at the undergraduate level, we focus on the rib one. So we have to know in and out about rib one, and rest is just like you know that they exist, but clinically they are not that relevant for us at this point, of course. And this particular typical one, which you will be going to focus over here. So whenever you are given this particular rib, which is kind of like a long bone, which is a kind of having a different shape, which is carved. So it's a carved long kind of bone, have got two ends, just like any long bone has upper end, shaft, lower end. This one have two ends. One is called medial end, other is called lateral end, and it has a shaft which is placed in between this, which is carved compared to the other one. These curvatures have a special name. We call them as angles. So whenever you are going to discuss about the typical rib, we call them as parts of it. So this is how this exam begins, like a discussion on an exam begins. What are the basic parts of it? So whenever you are given this particular question, you have to just say these particular parts. We call them as like medial end, lateral end, and shaft in between. These are the parts A, B, and C. Each of these particular component have got special features that comes afterwards, like head, neck, etc., etc. In case of this particular ribs, this particular medial end and lateral end has got attachments. That means it is attached with some bones. So these are like the parts that needs to be taken care of regarding to the joint formation. So medial end, that means going to the midline, it is sternal end as well. And this, the one which is going to be this like laterally moved going on the posterior side, we call this as a posterior end, which is also known as vertebral end. So this particular lateral one is just like not a very existing part. We call them as medial end, which is going to the sternal. We call them as sternal end of it, also known as anterior sternal end and posterior vertebral end. So these are the two divisions or two parts of it, and in between this anterior and posterior, we have a shaft existing in between. And this particular nature of the shaft, it is carved. So we have a carved shaft where which is placed in between the anterior end and the posterior end of this particular rib. Now once you take this particular anterior end, posterior end, which you have to find, then we take one at a time. Say for example, posterior end have got features. So we are going to discuss about this general features of a posterior end, then we talk about this anterior end, the shaft. The posterior end has a nodule, we call them as head. So you have to identify the head. Once you identify the head, the determination side of these ribs becomes easy. So once you identify this particular nodular head, it has a facets on it. So head with facets. for the attachments to the vertebra. So it has two facet, two of them, one is above, one is below. So upper and lower facets are there, which is present in the head. Next we have a short neck, which is present just adjacent to this particular head, which is a compressed part. So after this neck we have a tubercle or bump. So these are the three features this particular posterior end head. Posterior end has head, neck and tubercle. Tubercle also has facet for attachments. So once you see this particular head, that helps us to identify or determine the side of it. We see that if you given this particular bone, which is a carved kind of like long bone, which is called as typical bone, which we are going to study, which has similar kind of feature. So once you have this particular bone fitting over here, this end and this end, these are the two ends. Out of these two, you have to figure out which is anterior, which is posterior. Easy to identify the posterior end, which is having a head or kind of swelling or this kind of roughness or circular or semicircular part is there. This helps us to identify this posterior end or head of it. Once you identify the head, it has a facet which is splitting into two parts, upper and lower. The lower one and upper one is divided by a ridge in between. Then we have this particular narrow part, we call them as neck. Then we have this another elevation, this one where I am putting it, we call them as tubercle. So this part we call them as posterior end of it. This is related to the vertebra, so we call them as vertebral posterior end. Opposite side will be the anterior one, also known as the sternal one, which is fitted with this costal cartilage joining with this like a sternum in front, the costo-chondral junctions, which is making out here. So once you have this particular posterior end and anterior end identified, then we have this particular thing which is running in between, carved thing, we call them a shaft. So this particular shaft which is present in here, which is carved, it has two basic curvature or angles. So we call this particular shaft having two angles. So after this posterior end having this particular feature, once you have identified, we have to identify the shaft which is carved here. The number of curvature in here is 2, and one is known as anterior and posterior curvatures. So we call these curvatures as angles. So anterior angle and posterior angles, which are nothing but the curvatures on the shaft. Now once you see the shaft, it has an upper border, it has a lower border, it has an inner side, it has outer side. That means once you have this is shaft, it is carved. So this have a bend here which is turning this thing's front, and this here as well it has a bend. So this front side has a bend, we call them as anterior curvature. The posterior side has a curvature, we call them as posterior end or posterior bend. So these are the things which is making this particular rib bend, and we call them as angles of this particular shaft. And it has an upper border and lower border. Easy to identify the upper border and lower border is that upper border is smoother, lower border is sharper, and you can feel that if you run the finger, you can feel that this is smoother, this is blunt, and this is sharp. And under to this under surface we have a groove here. So this shaft entire thing on the under surface has a groove under to it. We call this groove as intercostal or subcostal groove. So intercostal groove, which is present on the under surface or under border or lower border of shaft. So this is the way we can identify the superior side, inferior side, lateral side, medial side, and this particular ends of it. Now then we are left with this anterior end. Anterior end doesn't have that much of feature which this posterior end or shaft has. It is blunt and it is square shaped, like roughly. It has anterior surface, posterior surface. It has or medial surface and anterior surface, and it has a end which is medial end, articulates with this costal cartilage and making this particular joint which is present in it. And this, depending on how these particular ribs are there, it is participating on the movements on the chest wall. So upper 6 ribs makes a movement, lower 6 ribs makes a different kind of movement. So I will just project these things which is related to this particular rib with this slides on, which will give a quick visual, and again we can come back to the chalkboards to understand further about this particular ribs or parts or components of it. Now this is one of the easy bone to pick up in examination. If you have prepared well, this is like a nothing. So in many times we see that smart students picks up this particular bone for identification and gets easy marks, and exam questions goes through with this particular ribs well whenever you are taking this particular osteology exams. So this is the basic divisions of it. Two ribs, false rib, floating one, 11 and 12. 12 one specially never participates in it, hangs free over here. And this particular ribs can be classified typical and atypical. Atypical dissimilar looking, typical one similar one. 3 to 9 is the typical one which we are going to study or we are studying today. Atypical one, out of them many of them are there. For the undergrads, the number 1 is important. I will emphasize where you are going to study this this particular number 1. Now out of this, whenever you are given this particular ribs, you have to identify these ends first. So once given over here like this sample, this is a rib which you have identified. There are two ends are there and a curved shaft in between. So once you are given here, first thing is you have to identify the which end you are seeing it here. Easy to identify this particular semicircular or oval kind of thing, we call them as head, which has a facet and the ridge in between. So this particular ridge with this particular facets easy to identify. Then you have a constricted part and then you have the tubercle. So this makes this whole thing as this vertebral or posterior end of the rib, and opposite to it, it has this particular thing which is called them as anterior end, which is not having any kind of such features compared to this posterior one, which is kind of flat square shaped, and it fits with this costal cartilage and joins with the sternum. Now this part, curved one, we call them a shaft, which is shaft over here is curved and it has two bends. One is on the posterior side and one is on the anterior side. This thing we call them as bends and called as angles. The posterior one we call them as posterior angle, the anterior one is called anterior angle. Now why these particular angles I am talking again and again? Because these are the prone sides where the ribs gets fractures. So if you have trauma to the ribs often gets fractured, which is kind of like a thin delicate bone. If it fractures, the fracture point prone area is the angles. So just like in the clavicle, remember we studied that fracture prone area in the clavicle, fracture prone area in this particular humerus. So similar to that, this particular region, angles of this particular ribs, anterior and posterior, both of them are fracture prone region. That's why we have to know the significance of the angles. Then this particular have got surface, external surface, internal surface, upper surface, lower surface, or upper border, lower border. Likewise this particular thing is there. So easy to identify this upper and lower one. The lower one having a presence of undermined groove to it. We call this particular groove as intercostal groove or subcostal groove or below the rib groove. This groove which is present, and this particular border, lower border, is sharper compared to the upper border. If you see that this thing is cut over here, zoomed here. So this is the upper border, this is the lower border, and on the under surface you have this costal groove or intercostal groove there. So if you see this intercostal groove, which is a placement for these neurovascular structure, is there. We studied that in lecture classes as well. So we have this nerve, we have this particular vein artery, intercostal nerve vein artery, they are placed in here and they have a particular relationship out there. So this is how this particular thing works. Now focus in this particular head region, we talked about the facets. So we have facets which is present. In this one, the head has two of these facets are there. So all these particular ribs, we have 12 pairs of the rib. 12 pairs of the rib have got head which has got two facets for this and intervened by a ridge in between, except the rib number 1. So these 12 pair ribs, all of them have got on their head, they have two facets except rib number 1. So this particular facets which is there, one above and one below, the lower facets articulates with the body of the same number vertebra and the upper one articulates with the vertebrae above. Now if you see this particular vertebra, we don't have it today. So we have this vertebra which is attaching on it. So we have this particular ribs attaching in two pieces of vertebral body. So if you have this, ওখানে আছে না আমাদের ওই রকি ওই ডেস্কে বসে আছে দেখ কেউ বল কি যে দুটো বা একটা দুটো ভার্টিব্রা যদি একটা চেইন আছে ভার্টিব্রা ওটা একটু দিয়ে যেতে বল So this particular facets or on the head is for articulation with the vertebral body or sides of the vertebral body. So, making the joint is costo-vertebral joint, alright. So, this particular costo-vertebral joints which are uniting over here has a particular pattern. The lower facets or inferior facet and having a superior facet. The inferior facets articulates with the same number vertebra. That means take this particular rib as rib 3. So, the rib 3 have an inferior facet and have a superior facet. So, this particular inferior facet will be articulating with the vertebra number T3 or body of the T3, and this particular superior facet will be articulating with this body or sides of the body of the T2 cervical thoracic vertebra. Get it what I am trying to say? So, this facet is for articulations on the sides of the vertebra. Now, after this we have this particular neck, and then we have this particular tubercle. So, this particular tubercle has also two parts, one is smooth part, other is rough part. Rough part is articular part, that means it is articulating with something. Now, if you look this particular vertebra, most of the vertebra have a transversely placed bone piece, we call them as transverse process. So, that particular transverse process articulates with this particular tubercle. So, same number thoracic vertebra cervical tube articulates with the same number tubercle with this particular making a joint over here. We call them as costo or transverse joint which is present with this vertebral body. So, this particular articulation, what exactly they mean with here, what articulates with it, that you have to keep in mind regard to this like a bony articulations over here, where this particular head articulates, that you have to know, and what this particular anterior end of this particular ribs articulates here, that we have to know out here. So, head, neck and the shaft, that's the three parts of it. The shaft have got two angles and this particular anterior end articulates with it, and head have got facet, neck and this tubercle which composed within this particular head. And this particular body have got upper end, lower end is artified by this presence of costal group which is lodging this particular neurovascular structure. And that we have to know what is superior articular facet on the head and inferior articular facet intervened by this ridge, and what present in between them or what articulates with it, that you have to know. Then you have to know this particular tubercle, what articulates with the tubercle, which is transverse process of the same number vertebra which is articulating with it. Now, this is how this particular atypical looks like. I skip it right now because that I don't want to make it like difficult at this point. So, this is what we are trying to say. This is a thoracic vertebra and this is the sides of the thoracic vertebra. Now, on the sides of the thoracic vertebra, we have facets like this. See that? So, this particular facets present on the body. This part of this particular vertebra. Thank you. Thank you. This part of this particular vertebra we call them as vertebral body, and these are known as process. This process is running transversely. We call them as transverse process. This one going down, which looks like a projected spine, we call them a spinous process. So, this particular spinous process which is going down and this transverse process, you see that there are two facets are there. This is on the sides of the vertebral body. This body is for the articulating with this particular with these ribs or head of the ribs. There on a vertebra you have two facets, one is above facet, one is below facets, and this one is a transverse process which having a facet which unites or articulates with it. This also is like seeing from above, this is one which you are seeing from sides. So, this is what you are seeing here, sides of the vertebra articulates with the ribs, above one and below one. The inferior one, the lower one articulates with this same number vertebra, same number rib. So, if it is T3, this one is for the rib 3 to attach, and this one gives attachment for rib 2, clear? And this transverse process is giving attachment of the same number vertebra, the same number rib. That means, if it is T3, this one is T3 and this one is T3 too, clear? So, this attachment is exam important over here. So, each facets making a joint at this region, we call them as costo-vertebral joints which is uniting over there. So, that is transverse process which is present over here, and with this particular body, these are synovial type of joint which is capable of making a movement, which is whenever you are breathing in, breathing out. That's why this particular ribs or movement of the rib cage is possible for us to do this. So this is what we are seeing here, stacked one after another, so T6 and T7. So this means the thoracic vertebra number 6 and thoracic vertebra number 7, and in between them we have a disc. We call them as intervertebral disc, which is cartilage. Now this particular rib attaches here, see that? So half of these things attaches the superior facet and inferior facet. So if you see this particular rib attaching, how it is placed over here, this is attaching on the sides or posterior side of the body of the vertebra, right? So this is anterior side, this is posterior side. How do you know? This spinous process which is on the back side. You are feeling this particular vertebra in the midline, that's the spinous process. So the spine is on the back side, we call them as dorsal spine or also back spine. So this is posterior side, this is anterior side of the image. Now you see that on the side this ribs is attached. So this ribs is making an attachment. Which part of the rib? This particular vertebral end of the rib. This particular vertebral end of the rib, which part is uniting here is the head. How this head is uniting? It has two facets. One is superior facet, one is inferior facet. The inferior facet of this 7th rib is articulating with these facets over here, and this one is articulating with the vertebrae valve. So this is how these things is uniting, and this transverse process is uniting with the facet. With the transverse process is making a joint which we call them a costo-transverse joint. Transverse with this costi, that means costo-transverse joint. These are also synovial joints. This kind of joints we call them as zygapophyseal joints together. Zygapophyseal joints. These are very important joints whenever you are studying this particular, like a back pain, back problems or back surgery. Whenever you're going to do, they are innervated by the spinal nerve, dorsal spinal nerves innervating this. These are becomes very painful if this particular like a synovial membranes, if it gets inflamed, they are very painful and creates a lot of trouble, especially the sports person. They have a lot of injuries on the back region, and these particular regions are often inflamed, becomes painful. So this is how this articulation takes place. You should be able to recall these things, how this particular ribs are attached in a typical one, and how this particular things in making kind of like a two facets to have this particular union taking place together along with the transverse facet, how they are attaching on it. So this is kind of like a thing that you need to study. Coming about this particular union on joints in the front side, you have already studied here whenever you are talking about this union or things related to the sternum. So this particular anterior end joins with the costal cartilage, making this particular joints over here primary cartilaginous joint only gets ossified. Right now it is kind of secondary cartilaginous joint. So this particular union which is taking place between the costal or costal cartilage, we call them as costal joints, which is present in here. So this particular points which is making a union where the anterior end of this particular bone ends, then you have the cartilage which is uniting with the sternum likewise and making this particular thing, making a union joints. So we talked about this particular joints beforehand as well. So we just skipping this and reaching to it. Now coming to this particular under surface of it, this particular groove have got like a neurovascular structure. Now talking about this particular muscle attachments, which is we are familiar with as well. We have three sets of muscles which are present in this particular region, and this particular muscles which is present in this particular region, we call them as intercostal muscles. We have three sets of this particular muscles which are present in this particular region. We call them as external intercostal, internal intercostal, innermost intercostal. So we have an idea how these particular muscles are placed and primed over this particular region. So this external intercostal, internal intercostal and innermost intercostal, they are present between the ribs. They are present in this particular right side and left side. In between them we have this neurovascular structure running, vein, artery and nerve, and this relationship we have to remember. Remembering this particular nerve hanging down lower in positions, making this particular nerve accessible for these doing interventions like doing anesthesia or any other procedures. Sometimes we have to go between this particular space and reach to the lung. So we call them as lung tapping or pleural tapping. That too, when we are going to talk about this particular lung disease and approach to the lung disease, I will refer that once again about this penetrating through without hampering these nerves or neurovascular structure, how we are going to approach to this, reach to the lung without damaging these nerves. So this particular muscle we have to know about. So how these particular muscles are placed and all these directions, if you remember it's well, If you do not remember how this particular muscle fibers are going and doing, no harm in it. Only thing is that you have to know, and there are 3 sets of muscles and how these muscles are present, outside to inside or inside to outside, and how these particular muscles are innervated by the nerves, which is intercostal nerves, which are supplying. What are the functions of this particular muscle, that you have to keep in mind, because that is a physiological thing, or the things which is clinically relevant. This particular muscles do not do any functions other than stabilizing in normal breathing positions. So they stabilize the rib cage whenever we are breathing in, breathing out. Whenever it is required to have an extra effort, then this particular muscle contract, like forceful inspiration, then on forceful expiration, then only this muscle contracts and make this particular rib to move in different directions, like transverse directions or anteroposterior directions, to stretch out this particular cage, so that the spaces within can be accommodated accordingly. We call this particular as the rib cage movement, which is present during the forced inspiration and forced expiration. So this particular thing that you have to know about, this is what we referred here before as well, about respiratory movements of thoracic wall and thoracic wall cage diameter, anteroposterior diameter, pump handle kind of movement, bucket handle kind of movement, and the vertebra and the diaphragm move separately, making this vertical diameter go on. So these are the movements of this thoracic wall have. They are very important itself. This particular, like first beginning lecture class can yield 4-5 easy questions regard to this particular regions of this question part in the upper extremity is concerned. So in a bone, whenever you're given, you are expected to hold it in anatomical position. So thing is that you have to keep this particular references in your mind, that what you are going to hold. If it is like a 2 set of bone, right side and left side, you have to figure out which is the right side, which is the left side. If you figure it out, you have to hold it in right side, or else you have to say this is the right side, or if it is left side, you have to make it like a left side. So once you have this, you have to identify which is right side and left side, putting a logic to it. So first thing first, you have to identify the anterior end and the posterior end of rib. So this is the anterior end, this is the posterior end. Once you identify this anterior and posterior end, between the shaft is there, which is present. Once you have the shaft, you have to identify which is the inner side, which is the outer side. The inner side and outer side is easy to identify, which is carved accordingly. Outer side is outwardly carved, inner side carved. Then you have to identify which is the above and which is below. Easy to identify out here is that inferior one have the groove and inferior border is sharper compared to the upper one. So this one is smoother, this one is sharper and having a groove under to it, which is helping us to make this particular lower or place it lower side, and this is on the upper side. This is on the anterior side, this is on the posterior side, and then this is to the vertebral side, this is to the sternal side. Once you have identified, this belongs to right side. So once you have figured out this is belongs to the right side, you have to just like let it go and make it towards this right hand and let the other hand go. Now, how these particular bones are placed? These particular bones are fitting with the sternum, and this one is on the vertebral side. Now the positions of this is not vertical. The ribs is directed from the back side is little bit on a higher position than the front side. So it will be tilted down. So you will be holding it in a little bit downward positions. The anterior end will be compared to the posterior one. So making a kind of angle where you can see. Easy thing is that I used to hold that in pen holding fashion, just like a pen I used to hold, and just like that's the anatomical position, and let go the other hand, and this is it, and mention it. This is what you're holding. This is a rib. What kind of rib? Typical rib, and typical rib of the right side, right? And what is the typical rib of? What do you mean by that? That means that it belongs to the group which is 3 to 9 group, right? So this is how the next question begins. How do you know that? Like again, you have to justify anterior end, posterior end, shaft, which is present on the shaft. What these particular angles are called? This is called as posterior angle, where it is bending here, and the anterior side where it is there bending. What is this inferior side is placed with? The groove here, which what lodges to the groove? What muscle is present above, right? So this is how this particular examination goes regard to it. So this is one of the easy thing to identify in examination if you have studied. Now coming to this particular head side, as you have mentioned, this particular head side which you seeing here has a facet here, one facet above, one facet below. The lower facet is for articulation of the same number vertebra of the side of the body. Upper one is the vertebra valve, and in between we have a ridge for the articulation of the intervertebral disc, which you have learned and seen there. So this is how it is going, and this one is the facet or the tubercle for the transverse process. So transverse process is making a joint out here. So costo-transverse joint which is present, costo-vertebral joint which is making on that. What kind of joint it is there? But synovial joint. What kind of synovial joint helps us to brings us to this particular joint? A movement during respiration, right? So makes these things flexible. So this is about. So grab this particular bones, whatever you get it, try to figure out which side it belongs, which is the typical one which you have studied. Individually make sure that you identify this particular thing and share with your friend that you are holding it right or not. That's the thing. And this is a vertebral chain that you are seeing here. Now this is a thoracic vertebra. Alright, let go, no problem. So this is a thoracic vertebra that we have just like a projected picture of. So this part of the vertebra we call them as vertebral body, and this one is projected part we call them as process. One of them is projected to the lateral side, we call them as transverse process. This one is projected on the back side, we call them a spine or spinous process. In between them we have a cavity which is vertebral canal or vertebral cavity, which is holding the spinal cord as this particular thing passing on. Now this particular thing, once you have there are other features I am not going to talk about, like superior facet, inferior facet, which is will be coming later on. Once you have identified the sides of this vertebra, you will be looking for these notches which is called a rib notch, right, or costal facets. In this region we call them as costi. Ribs is attaching here, we call them as costal facet or coastal facet. So one is above, one is down, which is present in here. And again, if this particular bone is given to you, ask you to identify what kind of bone it is a vertebral bone, and what group of vertebral bone it is a cervical segment or thoracic or lumbar, that you have to mention that this is a thoracic segment. How do you know? Because of these ribs marks on it. What ribs mark in? We call them as costal facets for the head articulations of the ribs. What ribs articulates? Inferior facets with the same number of vertebrae, superior one vertebra above, ribs above, and this one is the transverse process. You can see that this particular facet is also there in the transverse process. This is also the transverse process which is fitting with this tubercle of this vertebra which is fitting on it. So this particular thing helps us to identify this particular vertebra belongs to the thoracic segment of the vertebral group. Okay. So whenever we are going to study this particular thing again, we will be coming again to identify it. So if you can just like a habit, look at this to the facets on this transverse process, if it is there and as well as body is there, this makes this particular vertebra to identify as a thoracic vertebra. And this lumbar one do not have it, and the cervical one do not have either. So they have a different identifying feature to identify. So this is all about this particular thing. আর পড়েছে about this bone. Whenever you are holding it, identify the sides, right side or left side, anterior, posterior, superior, inferior, easy to identify and easy to go by. Okay, good. Doubt, questions? And don't forget about muscle attachments, which is theoretical, which you can make it out. 3 sets of muscles, 3 pair of right side, left side, above and below they have muscles attached. Intercostal space, each of them have got like muscles attached to it, which we already have seen, and in the lecture class as well we can see that. So there are a group of muscle attached here from here to here and here to here as well. So there will be just like a 3 groups of muscles which are placed in here, attached onto this particular region. We call them as intercostal muscles. So we have these muscles. So one is anchoring, like attached vertebra ribs above, anchoring to the ribs below. The similar thing happens over here as well as. So there are 2 pairs of muscles, intercostal muscles are attached on this particular respectively. One is above and one is below. So this is how these particular muscles are there: anterior intercostal, external intercostal, internal intercostal, innermost intercostal, and this particular plane of this neurovascular plane that you have to keep in mind, like layer 2 and layer 3, in between this thing, these 3 are present.